Now, self-funding government institutions have been engaged by the National Health Insurance Authority to ensure every Nigerian has access to quality health care through insurance. The agency says it is part of efforts to enforce compliance with the new mandatory health insurance law. TVC News' Kemi Balogun reports.
Following the enactment of the National Health Insurance Act in 2022 and the presidential directive that makes health insurance compulsory for all citizens, enrollment rose to over 21 million by August this year. To push the increase further, the National Health Insurance Authority has brought together representatives of self-funding government agencies to drive home one message: compliance with the mandatory health insurance law is no longer optional.
There was a presidential circular, right, saying that health insurance is now mandatory, and that's a call for action for NHIA. And for us, we need to engage stakeholders to let them know what mandatory health insurance means and how we can actually, through institution, ensure that we enforce this mandate. That will, take us to universal health coverage for all Nigerians.
Before now, coverage was relatively stagnant for decades, but some participants at this one-day sensitization workshop in Abuja say this is about to change.
For all the MDAs, for their enrollees, that means every staff should be registered. It's not optional that you are a staff and you're working for federal government, you must be registered. And then you should be able to access whenever you go to the hospital. The right drugs should be given, correct drugs should be given, original drugs should be given, because most times staff come back to complain.
With the new compliance drive, the NHIA hopes to bring Nigeria closer to achieving universal health coverage, where access to quality health care is no longer a privilege but a right. Kemi Balogun, TVC News, Abuja.